In the first part, I gave a short introduction to who we are and why we are here. So I'm gonna make it again, just to make sure that there may be some new people, but I will be quick. So my name is Sanna Turnas. I come from Tampere University. I have been preparing this event with my colleague Sophie, who was not, unfortunately, able to join us today. We are a part of the European Partnership on Transforming Health and Care Systems, which is a broad program. You already heard about that in the morning, and some of you already also in my previous slides. The THES program is a Horizon Europe co-fund action, and the aim is to create sustainable, efficient, innovative, and people-centered health and care systems. So there are the how questions, so coordinated research, innovation and capacity building, research and innovation project funding, and as well as stakeholder engagement. Then we come to the ecosystem part. So there is a lot of different activities and work packages. One of them is related to fostering health and care ecosystems. Our work package lead, Gerda Geier from Austrian Research Promotion Agency, is also here. Hi, Gerda. And in Tampere University, our responsibility has been to, together with all our partners, to detect, analyze, and now to promote transformative ecosystems. And we just, in the previous part, we heard two examples of how ecosystems in the regional level are able to create transformation, what could be kind of examples of this. Now in this panel, the aim is to go a little bit broader or deeper and have some different kind of perspectives to how the health and care ecosystems can become the engines of the systemic change. So now we use the examples of Mooi Maasvallei from the Netherlands and Trentino Salute 4.0 to dive into questions like what drives transformations, why ecosystems matter, and how to support them. And then I will welcome our prestigious panel members here. We have one person online. As soon as I will close this presentation, you will be able to see her. Hi, Vanessa, you are able to hear us, right? She's not? Okay, we will deal with that in a minute.
I'm here, Sanna. Sorry, I'm here.
Okay, great. So Vanessa is the program leader of the Mooi Maasvallei network. We have Riccardo Farina, the policy officer from Trento, who just presented the Trento example. Then we have Minna van Gerven from University of Helsinki, professor of social policy. And then we have Donna Henderson, our Transforming Health and Care Systems partner and head of international engagement from NHS Scotland. And then we have Sari Rautio, the president of the EPP Group and the European Committee of Regions. And last but not least, Carsten Framberg, professor of health policy from University of Copenhagen. So now I will just stop this, and we should be able to see Vanessa, and we also see Pauline. Okay, so we start now with some questions targeted to each of our panel members, but then don't worry, you will also have your chance again to ask questions and comment in a later phase. My first question is actually to Vanessa, who is online. Mooi Maasvallei really showcases how community-level engagement fosters transformation. So what kind of practices within your network have proven the most effective in sustaining long-term impacts?
Yes, good afternoon, everybody. And it's a shame I can't be there, but thank you for this opportunity. Well, it's hard to pinpoint one, but I think, as Pauline told before, it's very important to all have one vision and to listen to your inhabitants. What do they need and what can they do themselves? So these circles of prevention, precaution circles we talked about before, but also teaching children about nutrition are initiatives by our inhabitants themselves. So giving them space and holding that space is, I think, very important for long-term impact. That's why we do not have a steering committee who is driving the wheel, but it's a supporting group of board members and directors who really try to have an open dialogue and keep on listening to what professionals and inhabitants want and can do. Well, and of course, if you also arrange a very good digital and financial system, of course that helps, but it doesn't help if you do not keep in touch with each other.
Yeah, and that's where you've been very good at in Mooi Maasvallei. Yeah. So Minna, you also have your own background in the Netherlands, but you are also very well aware of the social and public policies. So my question now is to you and related to the Mooi Maasvallei example. So Mooi Maasvallei example really shows how the local community efforts can help improve health and care. So coming from your experience, what kind of rules or support are needed to make sure that these bottom-up initiatives are accepted and sustained in the broader health and care systems?
Well, I think this is both of the examples are very good examples of the matter of the context and contextuality, a very social science answer. Basically, the innovations, they don't grow in isolation, and I think the Mooi Maasvallei initiative is a great example how the Dutch highly decentralized government system gives the local municipalities first of all, the autonomy, but also secondly, the flexibility to actually support these kind of community-based ideas. And I think on the background, there are like three main factors that we need to understand why this works so well. And I think the first one is related to the long history and tradition in the Netherlands, what they call as the societal middelveld, the maatschappelijke middenveld. And that really means that the third sector, grassroots organizations, but also the companies, they have a recognized, a legitimate role in delivering these services. So very unlike in the Nordic countries where we have very extensive social sector, public sector taking care of these services, there's a very active and trusted network of actors who are working with that. And I think you can see it really nicely also here. The second thing is that, of course, in order to, it's not only about individuals, it's not about organizations, but what you need is a strong institutional coordination mechanisms between these different kind of actors. So in order to have these structures that help to align goals and resources across the sectors and actors, and this is the only way to make these kind of innovations work in practice, there needs to be joint leadership in that sense. Of course, there's always need to be some kind of a management of care manager, for example, from the perspective of citizens, but you can see nicely how these kind of coordination mechanisms are taking place in this example. And I think the third one is, what makes the world go round? Well, they say it's money. But I think there also you need to understand the specificity of the Dutch system in the sense that, of course, we already discussed, so where is the money coming from? And there's this commitment throughout the different actors. But there are also inbuilt mechanisms like the health insurance system in the Netherlands that combines the regulated competition together with incentives for innovation. And I think in the previous panel that we had before the lunch, we talked about we need to have these kind of incentives. And in the Dutch system, these insurance companies, they are really they need to invest as well in order to improve the quality of the services, but also reduce cost, of course. And this also brings in these kind of financial drivers for collaboration and experimentation and builds on this long history. So I think what you need is the trusted actors, good regional and collaborative governance and trust that has been said all the time. But in the sense, this transformation is not just a project, it is something to do with the government's environment that this happens. It's not the innovation itself, but it's the way that they are managing it that makes us to discuss it today. Thank you.
Thank you so much for this comment. Maybe before we move on, I just want to ask Vanessa a little short comment on these incentives by the insurance companies. So what was your thoughts on that? Did you feel you had the incentives also from that side?
Well, to look at it on the positive side, maybe it's increasing slowly. But no, I don't think that the system does provide more health, to put it this blunt. It provides good care if you're sick, but it doesn't prevent you from becoming sick. And I think that the production-based way of paying is not helping us, because it's also very structured by, you try to buy the best care you can and adjust some KPIs, key indicators that are not really helping the whole. So no, it's difficult, I have to say.
Yeah. Okay.
Right, Pauline?
I think the prevention is indeed an issue here. I think the focus on prevention will be difficult to sell anywhere. I mean, I'm a social policy scholar, and we need to explain everywhere why social policy is not just an expenditure, but it's an investment. So we are all there.
Yes, exactly.
True.
Now we move to Riccardo. Trentino Salute 4.0 ecosystem was selected as one of the beacon ecosystem for this comprehensive ecosystem approach, and also your shown results. I already asked about the policy support, but were there some kind of specific policy instruments that help you to build this ecosystem?
Well, during my presentation, for those who were attending before, I already provide some keynotes about this. But anyway, I think that there are two main policy instruments. First of all, the commitment of implementing innovation and digital health stressed in a provincial law, and then the factual succeeding implementation of innovation and digital health during the next year. First of all, in 2012, just 2 years after, with the creation of the platform, and then in 2016 with the establishment of the Competence Center of Digital Health. Of course, we were talking about fundings. We have a specific funding program for the center, so it's something that is steady. At the beginning, it was an investment, or is a tentative attempt. Is an attempt to see what happens. But after that, the policy side understand that it was something that was needed. So it is something that is supported over the years.
Then my next question would be targeted to Donna. As we heard this morning from Donna's keynote, she knows a lot about the digital models from the Scottish experience and the European experience as well. So Trentino Salute 4.0 really demonstrates how the digital health technologies can be embedded in the ecosystem settings. So what do you think? What are the lessons for the models, and how could this inform the strategies in other regions, and also how could they help scaling the digital health and care models?
How long have we got? I think there are lots and lots of lessons that we could learn. I mean, I think what struck me most was the slide. So for those of you who weren't in the room, your slide that showed the policy at the top and that 16 years of policy development, along with the co-creation, the research innovation services, and then the users. So that whole kind of visualization, I suppose, of how those component parts come together was really impressive for me. And I think you really hit the nail on the head in your presentation when you said policy endorsement is important to trigger transformation. And in my experience at that level, that national level, you absolutely have to have that. If you haven't got that, you can pretty much, you'll always just be tinkering around the edges of what the problem is. And I think Pauline reflected that as well when she said, you need your vision. So you need that mandate to change. I think the other thing for me that struck me about lessons learned from you is going back to, as I was saying, the way that you've structured it, it's very logical. You can see where those components come together and interact and feed each other, because that's incredibly important. One thing that we've heard, and I've heard it lots of times so far this morning and today, is this bit about trust. And for me, trust within an ecosystem environment is absolutely critical. And again, our colleagues from the Netherlands touched on this, with that challenge around one stakeholder group not having more authority or more say over others. And I think that the governance is very challenging to actually be able to put appropriate governance into your ecosystem that maintains that balance and so that everybody's voice is heard, I think is incredibly important. And I actually did wonder how you've gone about that within yours, because I didn't quite pick that up, but I got a sense that it is there. It's very much a balanced ecosystem.
Sorry?
So just in terms of how you govern your ecosystem, how do you...
Yes,
Yeah.
we have a government, as in the previous question. So we have a steering committee with the representative of each of the organization, and this is the upper level. So they set the strategies, the long-term strategies, and they monitor what happens. And then we have a technical committee that put in place the strategies. And so we met on a monthly basis with all the project managers of the competence center and also with the program manager to be updated about all the processes, all the projects ongoing, and the fundings and the criticism. So there is an attempt to be on the topic continuously.
But maintain the voices.
Yes.
I suppose the final point that I was going to really make was that what struck me about it is that, TreC Plus has really been developed to respond to the needs of your area. How then, and I'm just trying to put that into context for other regions and lessons learned, that can often pose a problem when you've then got other regions who are developing their own digital tools, and how do you then bring those kind of economies of scale together, when you're looking at the bigger national picture. So that was just something I think that many people might think, that's fantastic, but how do you then, stretch that out to cover others? So anyway, it was very impressive. I really liked it.
Thank you so much.
Thank you, Donna. I guess that's the issue with most of the ecosystem cases, and also something that we, in our work related to ecosystem in the Transforming Health and Care Systems program, the big question is always, so how do you scale up these models into another country context, a regional context, maybe also a little bit different emphasis. So this, I guess, there is no one simple solution for that. Thank you so far. And now we move forward to Carsten. You are the professor of political science in public health. So my question is related to both of these examples, the Mooi Maasvallei and Trentino Salute 4.0. So we can really see that both of these models show how the health and care ecosystems can work well when the strategy, resources, and actions are connected. So what kind of political and institutional factors would you say are needed to support and include these kind of ecosystems when it comes to national policies?
Yeah, that's a good question. So let me start by introducing a few sort of theoretical concepts about governance. Not a long lecture, but a very short version is that in political science we often sort of juxtapose a traditional public administration sort of characterized by rules, hierarchy, legality, and kind of rigid in a sense. We juxtapose that against new public management, so the idea that we should introduce private actors, markets, etc., much more flexible, much more dynamic, but also with some downfalls. And then the third sort of main category that we discuss is networks, and both of these are examples of policy networks in a sense, or policy delivery networks, and they have advantages, of course, but I think the trouble or the challenge with those kinds of networks is that they build upon the other types of governance, which means that they exist in a regulatory space, which both has these sort of rigidities of the traditional public administration. So you have to live with rules, you have to live with strict sort of accountability issues and so on. And you also have to deal with the public-private sector divide. So you need to be able to manage that you have private sector actors, that you have competition, and you have private sector interests also. So the answer to the question is that good governance to foster these kinds of productive networks is the ability to sort of juggle the pressures and the dilemmas that arise from living in a space with very different types of steering pressures. Mm-hmm. And I've got some ideas for that, but I think I'll leave it for the discussion further on. So, yeah.
Okay. Yes. So also kind of ecosystem thinking and collaboration is needed on the national level when it comes to support for the regional ones.
Sure.
Yeah. Okay. Thank you, Carsten. We probably will get back to your further points in a later phase. But now we move forward to Sari, who in the end brings the European perspective to our panel discussion. Sari is the president of the EPP Group and the European Committee of Regions. So the European Committee of Regions obviously doesn't only deal with the issues related to health and care, but probably related to many other things that support the prevention and people feeling well in their regions and environments. So the European Committee of Regions supports the regional voices in the EU policy making. So what kind of EU policies or policy areas does the committee promote to strengthen the regional health and care models, such as the Mooi Maasvallei and Trentino Salute 4.0?
Thank you so much for the question, and thank you so much for the possibility to be here. And congratulations to both to you and also in Netherlands. Great job, because this is something we definitely need. And coming from the Committee of the Regions, when you say that I bring the European voice, I bring the voice of different European regions, and that's what we are talking about here today. When we want to have the innovations, when we want to have the new way of working, when we want to functioning new governance, the change is done on the local and regional level, and then in order to make that happen, in the national level and also on the European level, we have to understand which are the topics we should decide together and then leave everything else on the lower level, closer to people. If we want to have impact, if we want to have competitiveness, if we want to have innovation. And today we've heard already that this is how it works. But the problem is, as you, Carsten, said, it is so difficult to let go and have the trust. And I think the trust is the key word. And of course, in the Committee of the Regions, we don't discuss basically at all about health issues, because that's under the member states' power. But on the other hand, as we heard today, both of these perfect examples, I think also you get also some funding from Horizon.
Yes, several projects.
Yeah, several projects, yeah. So there is a possibility to combine this European level, national level, and the local level. But when we look at to the future, it is crucial that today, when you have built your projects, or you have built your projects, it has been from bottom up. So the local and regional voice has been there to build the project, not even in the national level. And this is the biggest worry we have at the moment, and you all should share the worry with me. After 2028, the new multi-annual financial system, that gives a possibility to national governments to forget the regional level. And that is, from my point of view, the biggest risk at the moment, to have the innovations coming. So This is something very crucial because even though we have great member states, we have a very good collaboration and everything what was said, but you said very nicely, it's hugs and kisses, but not all the time. But anyway, we need to have the real power on the local level because the strength of Europe comes from the diversity what we have. And if and when I'm a true believer of ecosystems. The real ecosystems are built on the local and regional level. Yeah. And that's why the regions have to be not only part, but deciding when promoting, when planning, and in all levels. So that's the real multi-governance what we need in Europe, and that's the real regions Europe we need. So this is like the most important message. This was not what I was supposed to say, but after hearing this all today, because you already said everything, to prove that this is how it should be. But I only ask you for your help that we should make sure that also after 28 the regions and local level have their say.
Yeah.
Thank you.
Thank you. A very strong statement from your side.
Lot of work.
Yeah, a lot of work, but together we can work.
Yeah. So now that we know a little bit who we are and these perspectives, then I would now like to open the floor for discussions and questions to anyone. And then we will see if we have some comments from the audience, but now is also then your turn to reflect on each other's points if you would like to. But let's start now from the questions from the audience. Any thoughts?
Everybody's shocked.
So if you need some time to think about what you would like to ask or don't have any questions, then we can now first have the kind of open floor for reflection. So who would like to start? Was there some thoughts that you still wanted to add?
I think picking up on your point, Sai, I think there's a real opportunity here for the Transforming Health and Care Systems partnership to really work much more closely on the point that you've just made. So that sounds like something that we should be looking at for next year's work plan. Sorry to add something into that, but yeah. It sounds like a really good opportunity.
Yeah.
But I think the challenge is what my colleague Karsten was saying, that even if we were able to give the power where it should be, we are still bound by these governance mechanisms. And I think we all agree that the most difficult thing in the governance nowadays is to trust people, trust the implementers, that they actually do, because we have been so much absorbed this idea that we need to have a top-down management, we need to understand what is going on, we need to be able to measure it in order to it exist. That's why we talk about financial issues, because these are the things we can measure. So that is a very difficult combination of bringing these together, and this gives you now you can say all your points after this.
Please, Karsten.
Yeah, so I think just going back also to the point you made before, that it's really about finding out how this multi-level governance structure should work. So which decisions should be made at the sort of supranational level, which at the national, which at the regional, and which can we leave to these network processes, and how can we learn to sort of provide the sufficient space for them to operate on their own. And that, of course, when it's successful, it has a lot to do with this trust building and with gradually developing kind of institutional designs and leadership within the networks, so that there's a mutual understanding of where to go. But it's not easy for lawmakers and regulators to provide that space, because kind of the gut reaction if something goes wrong is to pull back the strings and to set new rules and so on. So we really need to think about how we can develop and design the structures so we know who makes what types of decisions and what the space is for decision making.
And Vanessa and Pauline, would you want to say something? Comment?
Yes, please. Well, the juggling is not a problem. That's what we do every day, and I think we're pretty good at it. So you can't erase any juggle situation. But I'm interested in the role of the region and the mandate that the region should get. Pauline, there are a lot of conversations about this now in the Netherlands with our government. So what can we do to help to bring that a step further? A question to Ms. Rautio?
Sari, yes.
Sari, yeah. Yeah, can I go on? Yes. Well, what I said in the during my speech, we've heard already today that it works. We know we can. I know it's difficult to measure, but we have to decide what are the things we are measuring, and then we come to the performance-based thinking. Even though there are problems with that as well, but we do have to change the system, as we've heard today. That the one that we are having at the moment is not good enough. So we have to focus on performance, and the performance comes from the common goal or the common vision, as you said earlier. And to build the trust, the most important thing is to have enough time when we decide the common goal. And we've seen that in Europe that we can do that during COVID-19, or even though now when it's really difficult times with Ukraine, we've been able to find big common goals, not to decide on everything on the European level. So performance-based is one possibility. The other thing is to find new ways of governing. The one good way where we have also good examples already is sort of an alliance way of working, where there is common leadership, but also common resources, and of course common resources also workers are the ones who are working on the issues. Yeah. So I think we ought to try and to measure these and well, originally I come from the city of Oulu, which is really up high north, and it's so-called the Wonder of Oulu that was born in the 70s, and that came when the University of Oulu, the city of Oulu, and the different enterprises, they built together the common strategy, as some of you mentioned also. And I think it starts from here. If we only wait somebody else to do it, it won't happen. We have to, in a way. And now it's the possibility. Now is the time to do the change.
Yeah, exactly.
It's not easy, but I'm sure if someone can do it, we Europeans can.
Yeah. So we have one question now from the audience. Is there the mic? Yeah. There. And then Donna.
So I have a question that relates back to our Transforming Health and Care Systems partnership, with a focus also on funding projects. We launch calls and we fund projects. And what struck me quite a lot in your presentations was the long time frame. Now you are there with a very good result, and of course you are continuing to evolve. But maybe 5 years ago, your presentation would have had a completely different focus. You were talking a lot about trust and policy support that is also necessary. And I was just wondering if you would have some takeaways for us also as a funding program in terms of what we should focus at in funding our projects. What should we give them as a takeaway? What could be features that we should be looking at in funding projects? What makes them successful in terms of transformation? Thank you.
Maybe we start with Vanessa being online. Were you able to hear the question?
Not completely. Can you
just in summary, to give some takeaways also for the funding organization. So how could they support this strong ecosystem from the funding of research and innovation projects.
All right. Well, I can give one or two. I think Pauline also has a strong idea about that. So please start, Pauline.
Well, what you hope is that everybody thinks about the way you do in the region. The transformative thing is that you think in a different way. You start in thinking, what does inhabitant need to stay vital, to live their life together? And that way of thinking, you expect that from everybody who wants to cooperate in having that transformation. So the question is not what can they bring? The first question is, do they think in the same way that you build up in your region together with all the participants and your inhabitants? And what can you add to that transformation? So we get a lot of mails and telephones from people who say now, after 10 years, well, that's very interesting. And they sort of want to get something from you. And we say, wait, we don't want to get something, gift something to you. We want you to cooperate in what we're doing and making it bigger and bigger. We have principles, we show them to you, and through that way we can help our inhabitants and make a sort of model for how you can act in the whole country. So we think differently.
Yeah. And Vanessa also had a point. Thank you, Pauline.
Well, because of what Pauline says, it's important not to bring a small bag for a small period of time for a small project, because that's not useful. So it has to be a system change. If you want to fund, you have to understand what you are funding, and it means you have to fund collectively, you have to fund prevention, you have to fund long-term initiatives in which the inhabitants have a strong position and not your own ideas of what should happen. So.
Okay, thank you, Vanessa. And then Donna did you still want to comment?
Well, it actually fitted in really well with what Pauline was saying. But yeah, I totally agree with that last comment as well, Vanessa. But it was striking me as we were talking just about governance and the challenges around all of that. And I was thinking back to Pauline's presentation and the types of services and initiatives that you've described and developed within your ecosystem are, where you're really enabling citizens to look after themselves. You're empowering them to actually take more responsibility for looking after each other and themselves, and moving away from that very paternalistic kind of approach that we've always had to, we do to people as health and care providers. We don't enable people to do for themselves, although we talk about it a lot. In reality, on the ground, we don't do much of that, but the services that she was describing are very much like that. And I think what strikes me about it is, within these ecosystems, this thing about how do we get the kind of governance and the coordination of it right. Maybe governance isn't the right word. The coordination of it right. To do, as you were saying, Pauline, which is that bit about get everybody moving at the same time. Everybody feels they've got something to do and contribute. How do you do that? And I think, your example has been incredibly inspiring. So thanks for sharing it. I suppose my question now is, how do we kind of replicate that?
Yeah. So first Carsten and then Sari, and then we still have a final round of short answers. But please, Carsten first.
Yeah. So a few points on the funding. I think, as already said, it's really important that it's patient money. So it should have the long-term perspective. It's not for a quick payout, but because these processes take a long time. It takes a long time to build trust and create things. So that would be the first point. The second would be that funding must accept failures. And actually failures can be good. So we need to fund projects that look at failures and draw the lessons from failures. So that's the second point. And the third point is that funding should be for the infrastructure, the research and knowledge infrastructure that can support the development of new projects and other projects. So all the stuff that sort of collects experiences and can apply knowledge about processes and steering mechanisms and so on. So facilitate new projects, and also knowledge infrastructure to do the performance measurement. So making sure that you have health technology assessment capacity within the area, and making sure you have academic capacity to support the work with reaching goals.
Yeah.
But goals, of course, and performance management is double-edged in a way. So it can support processes, I think, within the communities. But if it's very sort of rigidly applied from the outside, it can also stifle some of the innovation. So you need to it has to be administered carefully, in a sense. Yeah.
Yeah, definitely. I totally agree. Well said. Why I raised my hand was you asked how we can make everyone to move at the same time. We definitely need the visualization and openness, and not only discussing in different bubbles. So that's why I'm really happy that obviously I'm here, the only one who is only like a politician. Not in the substance, but I definitely think that when we want to make the systemic change and we talk about ecosystems, we have to take along all the stakeholders of the ecosystem and find a common language. And that's why we need the communication and visualization and openness also when there is a failure, because otherwise you can't build trust. So that is really crucial.
Yeah. Thank you for all the very strong statements that we heard today. And now is time for the final strong statements. So I'm asking you, what is the biggest risk if we don't invest in health and care ecosystems? And let's go a very quick round. Everyone points out one point, and we start from Riccardo.
Well, since from the beginning of this event this morning, we heard about the challenges that each healthcare system has to front. So the lack of workforce and the challenges related to digitization, the elderly that grows up. But all these challenges are intertwined. So I think that only an ecosystem can approach these challenges in an holistic way. Otherwise, no way.
Yeah.
The biggest risk is if we stick on to the old thing, we will lose even that. Yeah, we have to be able to renovate and rebuild the Europe on the regional level as well.
I'm going to make this really quick and say ditto to actually both of them, because that's exactly what I was going to say. We can't keep doing things the way that we've always done them. And this is definitely one way that we can start to see change, as we've heard from today.
Well, I think it was in the first panel that somebody said that the biggest risk of ecosystems is the fragmentation. And I think the biggest risk is that we actually are trying to fix these now today with digitalization, with easy fixes. But if the governance and the coordination that goes into the ecosystem lags behind of the technology that is brought into it, it basically just reinforces these silos. Yeah. So I think we need to be very aware that when we are digitalizing and automating stuff, that we actually understand why we are doing it and what we actually need to do. And not just to do the thing what we have done always, but actually come out of the box and think things new, because now it's the time.
Yes.
Yeah, I think we should think about it in terms of public value creation, and we need to be good at selecting the right tools, the right governance for the right purposes. So in some cases, these networks are the best way to do things. In other cases, it's probably other ways of organizing. So the biggest risk is we lose out if we don't sort of cleverly apply the right forms in the appropriate areas.
Yeah. And then finally, Vanessa.
Well, I will give the answer. Vanessa and I talked about it. If we don't make the transformation, we lose all the trust. Trust from inhabitants in the policy, in our healthcare organizations. People lose trust if you don't listen to them and help them in what they need. And your inhabitants are also your employees, are also your patients. So give trust to each other and listen to each other and build it in a normal way and don't make it very complex. So we have a lot to do, and we try to do that in our ecosystem.
Thank you, Pauline, and thank you, Vanessa, also online. Thank you, everyone here, for this great panel, and I hope that this has provoked some thoughts and give you some food for thought for building the ecosystems and or whatever. And then also from my behalf, thank you, everybody, for joining. So thank you.
Thank you, Sanna.
Thank you, Sanna.